Hey, what's up guys? Dan Conroy here. In today's video, I want to share with you some things I wish I knew about managing pain when I first started this journey 11 years ago. We'll cover some of the treatments that have worked, as well as some of the things I wish I never did. Most importantly, I want to share in these videos a positive message that there is light at the end of the tunnel. You can get to a good place with your pain over time and really improve your quality of life. As someone who's been through it all, I'm here to help you with that. As I'm sure you know, there are thousands of supplements, treatments, medications, doctors, practitioners, all offering services which can be pretty overwhelming when you're trying to decipher what to spend your time and hard-earned money on after battling with that impossible to answer question, how much is my pain worth? As I talk to you today, I gotta state I'm not a doctor. I'm just a very experienced patient. So before we get stuck in, I guess it's important to tell you how it all started. And unfortunately for me, it wasn't a tough guy sporting accident, a fight, or saving someone in some heroic gesture. My story is far more embarrassing in that 11 years ago I slipped and fell awkwardly just stepping out of the shower. But I fell from standing straight onto my sacrum. After about 10 seconds of shock, I realized I couldn't get up. I couldn't reach a phone either, so I just lay there pretty scared. It took me about an hour to work myself up to standing, but I was still limping for weeks. This is where the story starts to sound really similar to a lot of others I've heard, in that I got somewhat better over the course of the next month, but never really fully recovered, in that I had residual stiffness, I couldn't exercise the way I wanted, and I had difficulty sleeping due to the ongoing pain. After a couple of months, I went to see a specialist, and here's my first piece of advice. The sports medicine doctor with photos of famous sports teams they've worked with and signed jerseys on their wall has no correlation to their abilities as a doctor. They're running a business and it's just marketing after offering half a day of free consultations to the team. This was made clear after a few x-rays and MRIs were ordered, a few disinterested chats, several sessions at a few $100 each, the final verdict, a confused face and the advice, you look like you still work out, what's a guy like you complaining about? Go away, there's nothing wrong with you that movement won't fix. I had to battle this assumption time and time again since then that if you stand up straight and you look healthy, how could you be suffering chronic pain? You're often dismissed without really listening to what's going on. Funny thing is, I was angry with that at first, go away and get moving diagnosis after spending so much money and time, even though it leads me to my second piece of advice, which is if you have the go-ahead, movement is one of the key parts of my current pain management plan, and it just might help you too. I'll get into that in a separate video. My younger self just wanted there to be something simple I could point to and treat, which leads me to my third piece of advice. Pain isn't always the result of something mechanical being broken. It's far more complex than that and involves psychology, nerves, your environment, stress. So don't get frustrated if your scans don't show you specifically what's wrong. If you're in pain, there are many ways to treat it that don't involve physical intervention, and I'll do a separate video on the pain psychology treatments that have really helped me in some of my darkest times. I did try those recommended movement classes for core strength, but as the only male in a class designed for post-pregnant women, they'd call me out specifically saying, Dan, you know the muscles you use to pull your man parts away from the cold surf as you walk in? That's your pelvic floor. This was somewhat humiliating during the class, but to be honest, I immediately knew the muscles she was talking about, so it worked. Which leads me to my fourth piece of advice. Don't let embarrassment get in the way of trying new things or asking for help. If someone has recommended something and you're able, then try it. This might be the thing that changes your life. But for me, it wasn't those classes and my pain persisted. By this time, it had become chronic by definition, which is pain that persists for more than 3 months. It started to influence my mood, stack this on with the fact I'd started a new job in consulting, having to sit in workshops and listen for long periods of time in clients' premises where your seating options are often a box, a metal stool, a hard conference room torture chair, uncomfortable by design to keep people awake. For many of us, the workplace can even be the source of our injury, or if not that, working for long periods can aggravate it. So trust me when I say I understand the stress this can cause. Trying to pay attention, learn a new job, smile when meeting new colleagues, all while trying not to be that guy who needs the special chair or to disrupt a meeting because I needed to walk around the block. So I just suffered. Again, bringing me back to the fact that embarrassment shouldn't stop you from seeking help. I really wish I had just said, I need a different chair. No one judges you when you explain what's going on. I've found some really great ergonomic hacks if you have a job where you sit for a lot of the day, and I'll put some links to those in the description below. I feel like over the years I've also tried all the medications. muscle relaxers, antidepressants, opioids, CBD, THC, anti-inflammatories, benzodiazepines, trazodone, ketamine, all of which have some pros, but also come with some pretty serious side effects. Out of desperation, I've even experimented with the slightly underground path of self-prescribing peptides and magic mushrooms. I'm going to do a video on my experience with each one of these, the pros, the cons, successes, failures, so if you're interested, check those out. This leads me to my fifth piece of advice about the very fine line between using medication in a helpful and necessary way in order to improve your quality of life versus it becoming problematic and leading to other issues. I strongly recommend you talk openly and importantly honestly with your doctor about the medications you're using, even the off-label ones, as there can often be much safer combinations that can be even more effective, as alcohol and opioids do not mix. I kept searching for an answer. I got a bone scan of my back and pelvis where you swallow a radioactive tablet. 30 minutes later, they scan your body to see where the radioactive blood is pooling. Kind of scary, but I was desperate and still needed answers. I tried yet another doctor who found a labral tear and bone spur in my hip, which despite sounding terrible, actually made me really happy, thinking I'd finally found something I could treat. My surgeon gave me really honest feedback that surgery actually has a lower success rate than physical therapy for this, but I wanted it fixed and fast because I was in the process of moving to the US, so I went ahead with the surgery, but this was probably the worst mistake I made on my pain journey. I really wish I'd have spent time exploring other options. Surgery should have been my last resort, not my first, especially given the advice from the surgeon in the first place. Something happened during the surgery, no mistakes were admitted, but I was left with some nerve damage, and instead of surgery making me better, it made me a hell of a lot worse. I couldn't sit for more than a few minutes at this point on a normal office chair, and I started using more and more opioids in higher and higher doses just to get through the day. This is usually recommended for a week or so after an operation, but we've all heard the horror stories of long-term use, and I didn't want that to be me. So I just went back to the surgeon, had some more scans, he found some internal scar tissue, and he went back in a second time, but this made it even worse. And now, because I was so close to moving, I didn't have time for any other options, so I left in an absolute mess. I arrived in the US in 2017, just as the CDC was clamping down on these kinds of medications. This added so much stress, because every visit I felt like I had to convince the doctor I wasn't a junkie. I was using medication as prescribed, pushing back that residual fear that if I didn't get it, I couldn't concentrate and do my job, which would put my visa at risk, and the stress compiles, making the pain even worse. To try and reduce my reliance on medication, I kept trying every other treatment. Prolotherapy, cortisone, nerve blocks, radiofrequency ablation, epidurals. I talked to doctors about screwing my sacroiliac joint in place for, wait for it, $80,000 out of pocket. And another one who recommended a spinal cord stimulator, which actually makes perfect sense. It's an electrode that's inserted into your spine and disrupts the pain signals without the need for medication. But given my previous outcome with surgery, I was obviously pretty apprehensive about someone cutting into my spine. This leads me to my sixth recommendation, is getting unbiased reviews. When I asked the doctor if I could talk to a previous patient who had this procedure, he didn't have anyone to recommend, which led me to believe he'd either never done it before or didn't have anyone willing to give a positive review. If you get a treatment that changes your life, you want to tell people about it. It's what these videos are about. So seeking second opinions, not only from doctors, but from patients, is something I still practice to this day. If you're going to try something and you're nervous or uncertain about it, talk to someone who's done it, either through your personal network, or you can find whole communities of people online talking about their experiences with these procedures. If your doctor's willing to make an introduction, that's even better, obviously keeping patient privacy in mind. This leads me to today. After 11 years of trial and error, I'm now in a really good place with my relation to pain, and it hasn't gone away completely, but it doesn't scare me anymore. I've realized the power of pain positivity, the belief that things can improve. With the help of my doctor, someone who I am forever grateful to for helping me feel really comfortable being honest with, I've discovered the right, safe mix of medication that works for me, which is my last and most important piece of advice. Find a doctor you can be honest with, talking to about your pain. 1, so you don't diminish your symptoms when you're describing them, and 2, so they can work with your other medical providers to give you a full and comprehensive treatment, which is really important for the very complex condition of chronic pain management. I do want to leave you with a positive note. Pain is inevitable in life, but suffering is optional. I hope these videos help you feel less alone, and I know it sounds cheesy, but there is a place somewhere over the painbow. If you're interested in any of the content I talked about in this video, leave a comment below. And of course, if you want to see more, like and subscribe. See you soon, guys.